Yes, thank you. I represent the small hospital on the western coast of Norway. It's depicted here. It's a hospital of rheumatology, and this will be a brief presentation for about 5-6 minutes about what we can offer. It's a specialized hospital for rheumatological disease, mostly, but also including dermatology and orthopedic surgery. The hospital is originally from 1957, but it's newly renovated, completed in 2016. Our owners are Haugesund Sanitetsforening, which is an ideal company, which means it's a non-profit organization. And all of our health services is provided on behalf of the Norwegian state. When it comes to clinical activity, we have 3 modernized outpatient clinics. We have the rheumatological, we have a dermatological, and orthopedic one. In addition, we have an own hospital ward. We have 16 beds for the moment, containing mostly rheumatological and orthopedic patients. Also some beds for rehabilitation. We have a new operation division with 2 modern operating rooms. And we have built out the hospital, so now we have quite spacious and flexible exercise area. So we have exercise areas big enough to run or organize for 100 rehabilitation patients per day. When it comes to the dermatology clinic, it's quite modernized, and the picture here is from a newly opened clinic of STD disease, which is sexually transmitted disease. And to do the opening, we had the Norwegian Minister of Health, Bent Høie, on the right here. We have a holistic approach to all of our tasks. So we host a lot of professions, which makes our multidisciplinary team. And for all of our tasks, we have the ambition to keep the patient in the center of the goals of our tasks. There is quite a substantial part of our business which is orthopedic surgery. Here are some key numbers. We have 900 operated patients in 2017 so far. We have 3,000 outpatient consultations so far. We have quite a low infectious rate, and we have good postoperative results in prosthesis durability, which is increasing by the year. All of our patients have single rooms. We have top modern operating rooms. And the staffing for the orthopedic surgery department is 3 specialists in orthopedic surgery and 1 specializing doctor, and we have 1 anesthesiologist, 2 nurse anesthetists, 2 surgical nurses, and 2 technicians. And we are newly approved as an educational facility for orthopedic surgery for 2.5 years. When it comes to competence, we are quite a small business. We have only 130 employees, and we have quite a high rate of women, 80% women. We have a lot of different professions, and as I said 2 pictures ago, we have a holistic and multidisciplinary approach to all what we do. And all of our employees are quite happy by being employed by us when it comes to interviews and such. So we have quite satisfied staff. When it comes to research, that's also one of our tasks on behalf of the Norwegian government. So here's just some few lines about what we do in around that. We are an active participant in national studies, amongst others, improvement treatment of rheumatoid arthritis, which is obviously an area that has been happening quite a few we've come very far. Only the last few years. We are active participant in a study with improvement computerized navigation of inserting knee joint prosthesis, and safety and effect by switching selected pharmaceuticals for defined diagnosis, so-called biosimilars. And just as an example for selected pending research, we have the giant cell arthritis runs out of the university in Bergen. And we have one in the therapy department. Could intensive occupational therapy reduce or postpone the need of surgical correction of the arthrosis of the thumb? Our hospital lies, as I said, on the western coast of Norway, so that means there's quite good conditions for fishing and marine activity. And also we lie only a couple of hours drive from skiing resorts in the wintertime. And there's quite easily good infrastructure connections to Oslo and further out when it comes to getting there. This is a picture from down in downtown. And the top picture here is the view from our restaurant on top of the hospital building, which is quite spectacular, and I have a picture here of one of our colleagues in a therapeutic situation. More about us and the positions we have and employ will you find on the Øres site for this event. And I can also be contacted there, my details are there. So thank you for the attention.